A bone fracture is a break in the continuity of a bone. There are many types of fractures, but they all involve some degree of damage to the bone. Compound fractures, also known as open fractures, are a serious type of bone fracture. They are a medical emergency that requires immediate attention. In simpler terms, imagine a stick snapping in two. That's a simple fracture. Now, picture the broken ends of that stick poking through the skin. That's a compound fracture. Compound fractures are more complex than simple fractures because they involve an open wound. This means there's a direct pathway for bacteria and other contaminants to enter the body, increasing the risk of infection. Understanding the nature of compound fractures is the first step towards ensuring proper treatment and care. Compound fractures are usually easily identifiable due to the presence of an open wound. This wound is the most alarming visual cue, often exposing the broken bone. Imagine a soccer player colliding with another player, resulting in a visible bone protruding from their leg. This is a stark illustration of a compound fracture. The bone might not always protrude, but the open wound itself signals a serious injury. The wound can vary in size and severity, from a small puncture to a large laceration. The skin might be torn, crushed, or scraped away, exposing the underlying bone and tissues. The sight of an open fracture can be distressing, but it's crucial to stay calm and seek immediate medical attention. Compound fractures are often the result of high-energy trauma, where a significant force acts upon the body. Think of car accidents, where the impact can cause multiple and severe injuries, including compound fractures. Falls from heights are another common cause, especially among older adults. Imagine an elderly person missing a step on the stairs and falling, resulting in a compound fracture in their wrist. Sports, while beneficial for health, also carry a risk of compound fractures, particularly in contact or high-impact sports. Picture a football player tackling an opponent, only to suffer a compound fracture in their leg due to the forceful impact. Lastly, any direct blow of significant force, like a hard fall against a sharp object, can also lead to a compound fracture. The symptoms of a compound fracture are usually quite evident. Pain is often immediate and severe, localized at the site of the fracture. It's the body's way of signaling that something is wrong. Bleeding is another telltale sign, and it can range from mild oozing to profuse bleeding depending on the severity of the injury. The open wound exposes blood vessels, making bleeding almost unavoidable. Swelling around the injury is also common, as the body initiates its natural inflammatory response to contain the damage. The area might appear red, warm, and tender to the touch. Furthermore, there might be a noticeable deformity, with the affected limb appearing bent or out of place. Loss of function is also likely, making it difficult or impossible to move the injured area. Section 5. Immediate action, first aid, and emergency care. Time is crucial when dealing with a compound fracture. Immediate first aid can make a significant difference in preventing infection and further damage. The first step is to control the bleeding by applying direct pressure to the wound with a clean cloth. However, avoid pushing any protruding bone back in. Next, immobilize the injured area using a splint or sling. This helps minimize movement and prevent further injury. Once stabilized, it's crucial to seek immediate medical attention. Call 911 or transport the injured person to the nearest emergency room. Remember, prompt medical care is essential for proper treatment and to minimize the risk of complications. Section 6. Surgical intervention, putting the pieces back together. Surgery is often necessary to repair a compound fracture and reduce the risk of infection. The type of surgery depends on the severity and location of the fracture. Open reduction and internal fixation, or ORIF, is a common surgical procedure for compound fractures. It involves making an incision to access the broken bone, cleaning the wound thoroughly to remove debris and contaminants, and then realigning the bone fragments. Metal plates, screws, or rods might be used to fix the bone in place, ensuring proper healing and stability. These implants act like internal scaffolding, holding the bone together while it heals. After surgery, the wound is closed with stitches or staples, and a sterile dressing is applied. The patient might be given antibiotics to prevent infection and pain medication to manage discomfort. Section 7. The healing journey, a stage-by-stage process. Healing from a compound fracture is a gradual process that takes time and patience. It involves a series of stages, each playing a crucial role in bone regeneration. The first stage is inflammation, where the body sends white blood cells and other healing factors to the injury site. This causes swelling, redness, and pain, but it's a necessary part of the healing process. Next comes soft callus formation, where a soft, cartilaginous tissue forms around the fracture site. This callus acts like a bridge connecting the broken bone ends. As healing progresses, the soft callus hardens into a hard callus, providing more stability and support. This stage is marked by a decrease in pain and swelling. Finally, bone remodeling takes place, where the body gradually replaces the hard callus with new bone tissue. This process can take several months to years, depending on the severity of the fracture. Section 8. Potential complications, risks, and challenges. While most compound fractures heal successfully with proper treatment, there are potential complications that can arise. Infection is a major concern due to the open wound, which provides a direct pathway for bacteria to enter the body. Signs of infection include fever, chills, redness, swelling, and pus drainage from the wound. Non-union occurs when the bone fails to heal properly, leading to persistent pain, instability, and decreased function. This might require additional surgery to promote bone healing. Malalignment happens when the bone heals in an incorrect position, resulting in deformity and potential functional limitations. Early detection and correction are crucial to prevent long-term problems. Nerve or blood vessel damage can occur during the injury or surgery, leading to numbness, tingling, weakness, or circulatory problems. Prompt medical attention is vital to minimize damage. Section 9. Road to recovery, rehabilitation, and long-term care. Recovery from a compound fracture is a journey that extends beyond the initial healing phase. Rehabilitation plays a vital role in regaining strength, flexibility, and function. Physical therapy is often recommended to help restore range of motion, improve muscle strength, and relearn movement patterns. A therapist will guide the individual through exercises tailored to their specific needs and recovery stage. Pain management is also crucial during recovery. Medications, ice, heat, and other pain relief techniques can help manage discomfort and improve mobility. Following the doctor's instructions regarding weight-bearing restrictions is paramount to avoid re-injury. Gradual progression from non-weight bearing to partial weight bearing and eventually full weight bearing is typical. Regular follow-up appointments with the doctor are essential to monitor healing progress, address any concerns, and adjust the treatment plan as needed. Section 10. Staying safe. Tips for preventing compound fractures. While accidents happen, there are steps we can take to minimize the risk of compound fractures. Wearing appropriate safety gear during sports and other physical activities is crucial. Helmets, pads, and other protective gear can cushion impacts and reduce the severity of injuries. Maintaining strong bones through a balanced diet, rich in calcium and vitamin D, and engaging in regular weight-bearing exercises can improve bone density and reduce fracture risk. Practicing home safety measures like removing tripping hazards, using non-slip mats in the bathroom, and ensuring adequate lighting can prevent falls, especially among older adults. Driving cautiously and adhering to traffic rules can significantly reduce the risk of motor vehicle accidents, a leading cause of compound fractures. By taking these preventive measures and promoting bone health, we can minimize the incidence of compound fractures and their potentially life-altering consequences.